So some of our patients ask, is there a way for me to enhance my breasts without the use of an implant? And of course, that is a possibility. That's a procedure we like to call fat transfer to the breast. So essentially, it's a favorite combination. We can take fat from somewhere that you don't like it and put it where you do like it. So in the breast, so that we can both enhance the shape of your breast, typically in the cleavage area or the social part of the breast, as I like to call it, and sometimes increase the size of it. Okay. Sometimes, of course, depending on the size of improvement that we want, this may require multiple sessions of fat treatment so that we can enhance to the size and shape that we want to achieve ultimately.
Let's talk about sizing, because every surgeon approaches this differently. And as a female perspective, Dr. Zamani and I have a very different approach. And for me, reoperation in the first year for size change is ridiculous. I don't want to see that. And published rates are up to 12 to 15% of people get surgery in the first year for size change. That means we didn't talk enough about it before. So let's talk about it. How do we pick the right size for you? Well, there are medical issues. We've got to look at you, proportions. How tall are you? How much do you weigh? What's your body shape? Are you bottom heavy? Are you top heavy? Do you have wide chest wall? All of this is really important. Then we've got to look at actual dimensions and width. How wide is your breast? Is it the right width for your body type? Because there are incidences where you may be too narrow or too wide. So we need to take that into account. So those two pieces of medical information will take thousands of implants and narrow it down to about 30. But now how do I pick the one set for you? Well, what do you want? This is the hard part. Okay, people tell me soft, natural looking. And when I actually dig into it, half of those people bring me Jennifer Aniston's pictures. That's what they mean. And the other half bring me somebody like Carmen Electra or, somebody else with a much larger looking breast. So I don't know what those words mean to every individual patient. So we do two things. We give you homework, Dr. Z and I give you homework. And there are two things that you have to do to help us see what's in your mind's eye. Number one, collect photos. It can be lingerie, bathing suits, surgical websites. Don't overanalyze. It's okay. Love it, love it, love it, hate it. Help us see what's in your mind's eye. Because we can look at those photos very quickly and we can see a trend. And if there's not a trend, we're going to point it out to you and help you develop, okay, what do I really want? The second thing is making a homemade implant. Okay, that sounds crazy, right? But this is what you need to do. Get a sense of volume. So if you take a Ziploc baggie, some people have used a shower cap, some people use the bottom of a pair of knee-high pantyhose, and fill whatever this device is with either dry rice or quinoa or anything like that, and build a hamburger patty. Here's the difference. If you go to Victoria's Secret, they're going to give you that chicken cutlet that goes underneath and pushes you up from the bottom. That's not what the implant does. The implant goes behind the entire breast. So it's much more like a hamburger patty. So you want to put on a tank top, something with zero padding, but a little shelf, and line the shelf. And get a sense of volume. Put that little hamburger patty in, go bigger, go smaller, and see what you want to look like. And then measure it. Please do not bring rice into the office. We have buckets full around here. Measure it in a kitchen measuring cup with milliliters or cups, it doesn't matter. And what we're going to tell you is, are you being consistent? Is your message consistent? Your pictures, your rice, your dimensions, your words, and finally the implant we choose. Are they all in the same consistent message? And if you're not, we're going to talk about it. We're going to try to figure it out. So that's how we do sizing, and that's how we avoid reoperation for size change in that first year.